Wow. Over 32.5 million adults in the U.S. have osteoarthritis. And, one of the most common spots it hits, the knee.
It's a huge number, and yeah, it really shows how important it is to understand this condition
Yeah,
and manage it too.
for sure. And, if you've been with us for a while, you might remember those earlier deep dives we did on knee anatomy and flexibility. Those really set the stage for understanding how exercises can actually help protect and strengthen your knees,
Mm-hmm.
especially when you're dealing with arthritis.
Absolutely. You need that solid base. It's like building a house, right? And
Mhm.
understanding your knee and how movement affects it, that's key for getting the most out of these exercises.
Okay, so let's get specific. What kinds of arthritis usually affect knees?
Well, there are two main ones. The first is osteoarthritis, which is basically the wear and tear kind. Happens over time as the cartilage in your knee joint wears down.
Mhm.
And then there's rheumatoid arthritis. And that one's an autoimmune disease. Your own immune system attacks the lining of your joints, causing inflammation and pain.
So it's not just a one-size-fits-all thing. The type
Mhm.
of arthritis you have changes what treatment is best.
Exactly. And, while rest might seem like the obvious answer when your knees are hurting, it's not always the best for arthritis.
Really? Why not?
Because gentle movement is actually really important for keeping your flexibility and strength. And it keeps your knee from getting worse. It's kind of a use it or lose it thing, but you got to be careful and controlled about it.
That makes sense.
Mhm.
So what kind of exercises are we talking about here? Should I be training for a marathon?
Uh-huh. Not quite. We want to focus on low impact exercises, things that are gentle on your joints but still effective. Think walking, cycling, swimming activities that get your heart rate up without too much stress on your knees.
Low impact.
Got it.
So how do we get started?
Just like any workout, you need a good warm up, especially if you have arthritis. It preps your body and lowers your risk of injury.
What's a good warm-up then?
You could start with some dynamic stretches, like arm circles, leg swings, torso twists. These get the blood flowing to your muscles and joints, making them ready for action. You could also do a short walk at a comfortable pace, just to ease into the workout.
Got it. Warm up first, then the main event.
Right, and remember, consistency trumps intensity. Aim for gradual and regular effort. Don't push yourself to the limit. It's all about working with your body, not against it.
Good reminder. Sometimes I get a little carried away.
I get it. But with arthritis, it's all about that balance, challenging yourself without overdoing it.
So what are some specific exercises I can do to strengthen the muscles around my knee?
Let's start with the quadriceps. Those are the big muscles in the front of your thigh. They play a huge role in supporting your knee joint.
So how do we strengthen those?
Straight leg raises are great for that. You do these lying on your back. Keep one leg bent with your foot flat on the floor. The other leg is straight. Tighten the muscles in your straight leg and lift it about 12 inches off the ground. Hold it for a few seconds, then slowly lower it back down.
Okay, that sounds doable.
Uh,
What else works the quads?
Wall sits are another good one, but we'll modify them so they're easier on your knees. Stand with your back against a wall. Feet shoulder width apart, about 12 to 18 inches away. Slowly slide down the wall like you're sitting in a chair. Keep those knees right above your ankles. Hold for a few seconds, then push through your heels to stand back up.
Wall sits. I remember those from gym class. What about the muscles in the back of my leg? The hamstring.
Ah, yes, the hamstrings. Those are important too. Bridge poses target those. You'll start lying on your back knees bent. Feet flat on the floor, press your feet down and lift your hips up towards the ceiling. Squeeze your glutes at the top. Hold a few seconds, then lower back down. This works your hamstrings, but also strengthens those glutes, which takes pressure off your knees.
Bridge poses.
Got it.
Anything else for the hamstrings?
We've got step-ups, but we're going to modify them to make them low impact. Find a sturdy platform or a low step about 4 to 6 inches high. Step onto the platform with one foot, push through your heel and bring your other foot up, then step back down, starting with that same foot. This helps build strength in both your hamstrings and your glutes.
Quads, hamstrings. What about those inner thigh muscles? Do those affect my knees?
Definitely. They help stabilize your knee and keep it aligned. Seated squeeze with a pillow is easy and effective for those. You just need a chair and a pillow. Sit on the chair, feet flat on the ground. Put the pillow between your knees and gently squeeze it for a few seconds, then release.
Sounds pretty easy. What other muscles do we need to think about for strong knees?
Don't forget those calves. Strong calves are important for balance and absorbing shock, which helps your knees. A classic exercise is the heel raise. You can do these standing up. Hold onto a chair or wall for support if you need it. Rise up onto the balls of your feet. Lift your heels as high as you can. Hold for a few seconds, then lower back down.
Okay, I'm feeling like I'm getting a good workout already. What's next?
We've covered a lot on strengthening. But there's another key part to managing arthritis knee pain. Flexibility and range of motion. Let's talk about that next.
Yeah, flexibility is something people don't always think about, but it's super important, especially when you have arthritis. Think about it. Stiff muscles and joints put more stress on your knees, and that just leads to more pain and less movement.
Right. I can see how that would be a problem. So how do we improve flexibility in our knees? Heel slides are a good place to start. You can do them lying down or even sitting with your legs out straight. Just slide one heel back towards your bum, keep the other leg straight, hold it for a few seconds, and then slide that heel back out.
Heel slides.
Yeah.
Okay, what else can I do to loosen things up?
Hamstring stretches. Those are key for anyone with knee issues. Tight hamstrings pull on your pelvis, which messes with your posture, and puts strain on your knees to stretch them. Sit on the floor with one leg straight out in front. Bend the other leg so your foot is against your inner thigh. Now reach towards your toes on that straight leg. Keep your back straight as you can. If you can't reach your toes, use a towel or a strap to gently pull your foot towards you. Hold it for about 30 seconds, then switch legs.
I always feel it in my lower back, too, when I do hamstring stretches. Is that normal?
Totally normal. Your hamstrings and lower back muscles are all connected, so you'll probably feel a bit of a stretch in both. And speaking of connections, did you know that even your ankles can affect your knees?
Really? I never would have thought of that.
It's true. If your ankles are stiff, it changes how you walk, and that puts more stress on your knees. So ankle pumps are great to add to your routine.
Ankle pumps sound easy. How do you do them?
You can do them sitting or lying down. Just point your toes up and down, like you're pumping the gas pedal. It gets the blood flowing and loosens up those ankles, which then helps your knees.
Interesting. It's like a chain reaction, keeping everything moving smoothly.
Exactly. And one more stretch for those knees is the seated forward bend. Sit in a chair, feet flat on the floor, and slowly bend forward from your hips. Reach towards your ankles. Keep your back straight and don't push too hard. This loosens up the hamstrings and lower back, which takes some pressure off the knees.
All right, I'm feeling more flexible already just thinking about all this stretching. Is there anything else we need to do for our knees?
We've got strengthening flexibility, but there's one more important piece: balance and stability. Working on your balance can really lower your risk of falls, especially if you have arthritis.
I'm listening. What kind of exercises help with balance?
Let's start with standing leg lifts. Stand next to a chair or a wall if you need some support. Now lift one leg out to the side. Keep your body straight. Try to keep that leg straight too. Hold it for a few seconds, and then lower it back down. Do the same on the other side.
Standing leg lifts.
Yeah.
Yeah, I can see how those would challenge my balance. What else can I do?
Single leg stands are awesome for this. They improve your proprioception, which is basically your body's awareness of where it is in space, helps with balance and knee stability. To do it, just stand on one leg. You can hold onto a chair or wall if you need to. Try to hold it as long as you can. Then switch legs. As you get better, you can make it harder by standing on something less stable, like a pillow or a folded towel.
So it's like training my brain to be more aware of my body. That's cool. What else can I do for balance?
Here's a fun one: toe to heel walk. It sounds simple, but it's great for balance and strengthening the muscles around your knee. Just walk heel to toe in a straight line, like you're walking a tightrope.
Toe to heel walk. I used to do that all the time as a kid. I'm realizing a lot of these exercises are just movements we did naturally when we were younger.
Exactly. It just shows how important it is to keep doing those basic movements as we get older.
I love that. It's not about complicated routines or equipment. It's about getting back to those basic movements our bodies already know how to do.
You got it. Now, before we move on from exercises, there's something super important I want to say. You should always talk to your doctor or a physical therapist before starting any new exercises, especially if you have arthritis.
That's good advice. They can help figure out what's best for you. So we've covered lots of exercises for strength, flexibility, and balance. But how do we actually make all this into a routine? Where do we start?
That's a great question. And it can feel overwhelming. The key is to start slow and build up gradually. Instead of trying to do everything at once, pick 2 or 3 exercises from each category: strength, flexibility, and balance, and do them 2 or 3 times a week.
So like straight leg raises, heel slides, and single leg stands for my first week.
Perfect. And as you get more comfortable, you can do more reps or add more exercises from our list.
So it's about finding that sweet spot, pushing myself, but not too much.
Exactly. And don't forget consistency. It's better to do a little bit regularly than to go all out and then have to stop because you're sore.
Makes sense. What about when my arthritis is really flaring up and everything hurts? Should I still exercise?
It's totally natural to want to rest when you're having a flare-up. And sometimes that might be the best thing to do, but gentle movement can actually help with stiffness and pain in the long run.
So maybe try some of the easier exercises, like heel slides or ankle pumps.
Exactly.
Yeah.
Or even just a short walk at a comfortable pace. The important thing is to listen to your body and do what feels right.
Listening to my body. That might be the best advice I've heard all day.
And it's not just for exercise. It's about understanding your limits and what your body needs.
I think we get so focused on pushing ourselves that we forget to just listen to what our bodies are trying to tell us.
It's easy to get caught up in that no pain, no gain idea. But with arthritis, it's gotta be about being kind to your body and respecting its signals.
I'm glad we're talking about this. I'm learning so much. So we've talked about starting slow consistency and listening to our bodies. Any other tips for making these exercises a regular part of life? Because let's be honest, sometimes it's hard to stay motivated.
Definitely. Finding ways to stay motivated is huge for making it last. One thing that helps is to find an activity you actually enjoy. If you hate swimming, don't force yourself to do it. There are so many ways to get exercise. Find something that works for you and that you like.
That reminds me of that quote, exercise is a celebration of what your body can do, not a punishment for what you ate.
I love that. It's exactly the right attitude.
It's about enjoying movement, not seeing it as a chore. Maybe it's a dance class or gardening or playing with your grandkids, anything that gets you moving and keeps those joints working.
For sure. And remember, exercise is just one part of managing arthritis knee pain. Eating healthy, keeping a healthy weight, and getting enough sleep are all important too. They all affect your joints.
So it's a whole body approach.
Exactly. And it's about finding what works for you. There's no one right way to do it.
All right, so as we wrap up this part of our deep dive, I want to leave you with a question. How can you make these exercises work for you? What can you change or adjust to make them fit your needs and what you like?
That's the question to ask yourself. It's all about making it personal and making it something you can keep doing.
We've covered a lot of ground in this deep dive into exercises for arthritis knee pain. We've talked about the different types of arthritis, the importance of movement, specific exercises, even how to make it your own. But I'm wondering, what does all this mean for someone who's actually dealing with this condition? Like, how do these exercises actually make a difference in their daily life?
You hit the nail on the head. That's where the real impact is. These exercises aren't just about managing pain. They're about giving you back your independence. Your ability to move around freely, to do the things you enjoy without your knees holding you back.
Okay, give me an example. Let's say I've been doing these exercises for a few weeks. What kinds of changes might I notice?
Imagine this. You wake up in the morning, and there's no stiffness. No more struggling to get out of bed. You can walk down the stairs without pain, and maybe even play with your grandkids without feeling like your knees are going to give way.
That sounds amazing. I bet everyday things would be easier too,
Right.
like carrying groceries or getting in and out of the car.
Exactly. Those simple things can become real obstacles when you have knee pain. But when you strengthen those muscles around your knee, you're less likely to have pain or feel unstable doing those everyday activities.
We talk a lot about the physical side of arthritis, but I think it's important to remember the mental and emotional impact too. Chronic pain can really take its toll.
Absolutely. It's not just about what you can or can't do physically. It's about how it affects your whole well-being. And that's another area where exercise can really help.
Okay.
Exercise has been proven to boost your mood and improve mental health. It releases endorphins. Those are natural mood boosters that can also help reduce stress and anxiety. So not only are you stronger physically, you're also better equipped to handle the emotional challenges that come with chronic pain.
So it's like a chain reaction. Taking care of your physical health through exercise can have these positive effects on your mental and emotional health too.
Exactly. And here's the best part. It's never too late to start. Even if you've been living with arthritis for a long time, adding these exercises into your routine can significantly improve your quality of life.
That's so encouraging to hear. So as we wrap up our deep dive today, I want to leave our listeners with one last thought. What else besides these exercises can you do to support your overall knee health? Maybe it's exploring other low-impact activities like yoga or Tai Chi. Or maybe it's finding ways to manage stress. Or even connecting with others who have arthritis to share your experiences and get support.
Those are all great ideas. Remember, taking care of your knees is about more than just exercise. It's a journey, and it's unique to each person. So keep exploring, keep learning, and keep moving. Your knees will thank you for it.
Well said. And that wraps up our deep dive on exercises for arthritis knee pain. I hope you found this information helpful and empowering. Remember to consult with your doctor or physical therapist before starting any new workout routine. And most importantly, be kind to yourself. Listen to your body and find what works for you. We'll see you next time for another deep dive into the world of health and wellness.